Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srindri Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. You can also visit my playlist. In the playlist, I have provided almost all the topics so far we have discussed in a very systematic order. So you can make use of it for the systematic study. Anyway, in the last 14-15 parts, we have covered almost all the basics of the fever, and we have seen what are the important questions that you have to ask whenever we are dealing with the pediatric cases of fever to have a very justified and loyal treatment. Okay, giving the medicine in the first day itself, fever is reduced but diagnosis is not over, and irrational treatment, they are the different issues. Okay, but as a good pediatrician, what you have to do is first you have to diagnose the cause of the fever, and then you have to act through the medications. Okay, unwanted medications has to be avoided because unwanted medications not only cause harm to the baby, more than that, it also hampers the natural course of the disease, so that diagnosis will not take place. Okay, see, many times infection will be there, maybe in the renal area. Okay, so fever is coming, and on the first day itself you treated it with some of the antibiotics or some other things, antipyretics, etc., and you never diagnosed the disease. The fever is just subsided, but that was a fever actually with probably pyelonephritis sometime. Okay, that means infection is taking place in the renal area, and you have not adopted or started with the appropriate antibiotics in that time, and that leads to some renal scar there. So when such repeated infections occur, and all the time you treat the fever without diagnosing, then it may be very dangerous. That's also the reason why the renal disorders are increasing in the present day practice. Okay, because in the childhood period itself, the pyelonephritis is one of the very common condition in children for undiagnosed fever. So anyway, these are the different issues. Okay, we should be very careful to study this fever in a systematic order. Now we have to take some of the cases. So if you look into one or two cases, then you will be very clear what should be your approach in the diagnosis of the fever. Now start with the case number one. See, this is a case number one. A child is there with the fever. Okay, now you have to answer me. A child is there with the fever, and onset is very acute, and high fever will be there. So first take the first sentence. You ask some question, onset. So mother is giving this answer. Child is having fever. Onset is very acute and there is high fever. So whenever you got this answer, what is going on in your mind now? It may be a viral fever, because acute and high fever can be seen in case of viral fever. It can be seen in case of bacterial fever. And high fever may be also seen in parasitic fever. High fever can be also seen in autoimmune fever. So nothing has been conclusive now, isn't it? So go to the next question. What is that? What is interfebrile period? So when you ask what about the interfebrile, whether the child was, what is the behavior of the child in the interfebrile period, fever free period, then mother told that interfebrile period is normal. Child is normally playing in the interfebrile period. When there is no fever, child is absolutely fine. So okay, normal interfebrile period. Normal interfebrile period is suggestive of viral infections. We know that. Normal interfebrile period may be seen in case of immunological fever. Yes, in between the long interfebrile period there is no any symptoms, and even in case of parasitic fever. So what is out now? Bacteria is out, because in case of bacteria you never get normal interfebrile period. Child will be sick during interfebrile period also, because bacteria will go into produce the toxins. The toxins will have long standing effect even in the interfebrile period also. So now with these two questions, bacteria is out. So we have excluded the bacterial fever. This fever is not a bacterial fever. So this fever may be a viral fever, this may be immunological fever, or this may be parasitic fever. Go for the next question. What about the rhythm of the fever? What about the rhythm of the fever? Now rhythm of the fever, mother is telling regular. It is coming on regular rhythm. It is coming on every 3 hourly. Every 3 hourly it is coming. Okay. So when the rhythm is there, malaria is out. Okay, rhythm is maintained, because malaria never maintains any rhythm. So now bacteria is out and parasite is out. Malaria, when I say it is parasite is out. Two things are left. Either it is a viral fever or either it is a immunological fever. If it is immunological fever, then we know that in case of immunological fever, there will be a long interfebrile period, not a short interfebrile period. Okay, so here mother is telling that fever is coming with a rhythm of every 3 or 4 hours. Okay, after giving medications, within next 2 or 3 hours again the fever is coming. So it is a short interfebrile period or short rhythm is there. So as it is short rhythm, again the immunological fevers are out. Now what is left is a viral fever. Now go to the next question. What is that? What is the progression of the fever on day 3 and 4? Mother is telling that the fever is gradually coming down. Fever is gradually coming down. Trend of the fever on day 3. So what mother is telling that it is improving. So now the nature of the viral fever is as the day passes, the intensity of the fever comes down. Bacteria, it goes on increases. Immunological, it's stable. So here the fever intensity is coming down. So now it is very clear that this is viral fever. Now you ask some of the associated symptoms. Last question. Associated symptoms, mother is telling child is also having cough, child is also having running nose, child is also having body pain. Now multiple symptoms are there. Multiple symptoms will be seen. So therefore it is always a viral infection. Multiple symptoms are seen in case of a prodromal or multiple symptoms will be seen in viral infections. So now if you go by this approach, you never miss a case. Okay. Now in this case, this is a typical case of a viral fever. So clear. So when you go by these 5 questions, things will be so clear. There is no scope for the error at all. Okay. And the diagnosis is viral fever. Okay. So usually in a viral fever, we will have the history of a contact also. If somebody in the home also suffering from the similar illness, viral infections may be spreading. So this is possible. So this is case number 1. I hope you understand. Similarly, we will see so many cases so that things will be very, very clear. Okay. Thank you very much.